Alright, now let's see the classification of vesicobulbous lesion. So they are classified into immunological disease, viral, bacterial, and hereditary. So under immunological, it is pemphigus vulgaris, mucous membrane pemphigoid, bullous pemphigoid, bullous lichen planus, and bullous systemic lupus erythematosus. Systemic lupus erythematosus. And then viral, under viral we have herpes simplex virus, viral zoster, hand, foot, mouth disease, measles. This is usually seen in cows. Okay. Bacterial, under bacterial we have bullous impetigo, and then hereditary, that is familial benign pemphigus and epidermolysin bullosa. So this is the classification of the vesicobulbous lesion. Now let's see in detail about lichen planus. So lichen planus, it resembles the structure that grows over the rock, like a grass which grows over the stone. So it is basically algae in symbiosis with fungi. So that's how it got the name lichen planus, where it occurs over the skin and the oral cavity. So it resembles like the plant. Now, it is a chronic inflammatory disease and immune mediated disease. So it affects skin and mucous membrane. And then the syndrome associated with this lichen planus is Greenspan syndrome, and it has a triad. Like these three will be common in this syndrome. That is lichen planus, diabetes mellitus, and vascular hypertension. So what is lichen planus? It is basically chronic inflammatory and immune mediated disease. That's it. So clinical feature, we have the age which is greater than 40 years, and then there is almost equal sex predilection. Buccal mucosa, flexon area of wrist and elbow, the trunk, inner aspect of knee and thigh. These are the main areas where the lichen planus is seen. Now coming to the clinical presentation, bilaterally symmetrical lesion, either a papule or a plaque. So it appears like that, and a grayish white line surrounds this lesion. So it is called Wickham's striae. This is an important point, Wickham's striae. And then what is plaque? Plaque means it is a reddish brown to purple. It ranges between brown to purple color, and it will be associated with these papules and also the Wickham's striae. Now coming to the etiology, as we saw here, the definition, it is immune mediated. So T cells are involved. So it is T cell mediated, and the CD8 cells and the T cells will cause apoptosis of oral epithelial cells. So there is apoptosis is programmed cell death. So they will cause cell death of the oral epithelial cells. And then exacerbation in nervous individuals, which means that the nervous individuals, the individuals who are nervous, the lichen planus will be more severe in them. And then it is also seen in malnourished individuals. And then smokers, tobacco chewers. Now oral manifestation, so the common site is buccal mucosa, lip, floor of the mouth, tongue, vestibule, gingiva, palate, basically every part of the oral cavity. And then what is seen there is a burning sensation of the oral mucosa, that is seen there. Now coming to the histopathological feature, so the main feature is like the retapegs. Retapegs is nothing but the epithelium which is projecting towards the connective tissue, that is called the retapegs. So that is seen here, and then basal cell degeneration is seen here, and then hyperkeratosis is also seen. Now the types. It's here's an easy mnemonic for the types. It is called prehab. P for papillar, R for reticular, E for erosive, H for hypertrophic, A for atrophic, and B for bullous. So these are the types of lichen planus. Easy to remember, right? Okay, so the treatment is basically corticosteroids along with topical steroids and maintaining good oral hygiene.